Next is Dr. Samuel Tega, a medical doctor who was working with the World Health Organization office in Makurdi. He died from Lassa fever. You know, the Pioneer News.ng, they reported what the doctor wrote, that we lost a colleague, Dr. Samuel Onyitio, on January 9, 2022. This doctor said, I lost two patients last week. One ate a rat and took ill. I'm currently taking prophylaxis ribavirin and isolating because I nursed two of the three patients who died. At the time, the Benue State Health Commissioner, at the time, Dr. Joseph Ungbia, said that for the doctor, we discovered that last year two people had Lassa fever in his compound. This means that there's a species of rats that moves around in that area and perches on people's food. Dr. Samuel Onyitio Ortega was also referred to the Irua Specialist Hospital for treatment, and he died at Irua, January 9, 2022. Next, Dr. Abubakar Saleh Moriki was a consultant at Karon Wali Clinic in Zaria, and there was another health worker who was working in the same clinic, Hamza Abubakar. They both had contact with the same woman suspected to be infected with Lassa fever. Dr. Moriki was admitted at the Tudun Wada branch of ABUTH Ahmadu Bello University Teaching Hospital, Zaria, on Thursday, March 17th. Subsequently transferred to ABUTH Shika, where he died on Monday, March 21st. Hamza Abubakar died 2 days before, on March 19, 2022. Then Dr. Alfred Ejiofor Uzoigwe, he was in Abakaliki, Ebonyi State, died April 15, 2022. I couldn't get much information about him, but Dr. Chinoso Ngimba, posted something talking about the unfortunate death of Dr. Alfred at the time in 2022. So here is accounts of doctors who have died from Lassa fever. So I still remember the unfortunate death of Salome Oboye in Bingham University Teaching Hospital in Jos. We also remember the other health workers, the other doctors and health workers who have died from Lassa fever. We should remember them, and we should take cognizance of the fact that doctors are like soldiers. Doctors, health workers are like soldiers in the war front against diseases such as Lassa fever. And like soldiers, these doctors and health workers pay the ultimate sacrifice. What can we do to help prevent the transmission of Lassa fever? What can we do to better protect our health workers? The government hospitals, private hospitals, efforts should always be made by those in charge of hospitals to provide personal protective equipment for doctors. There should be enough PPEs. There should be running water and soap where doctors can wash their hands. There should be provision of hand sanitizers. There should be better working conditions provided to limit the risk of doctors being exposed to this disease. When you send soldiers to war, you equip them with what they need. You equip them with things to protect themselves and with other things that they could use in defense and in offense. So doctors, health workers who are the front line fighting these diseases, you have to equip them, spare no cost at providing the things that are needed to protect them. They are valuable assets who the government have contributed in training. So now they are working on the front line, provide the things they need, provide personal protective equipment, provide training, provide all knowledge, information, provide good working condition, provide good welfare so that they can be protected against these deadly diseases, while also ensuring that you also put proper focus on research. The disease was discovered in 1969, and for how many years, for decades, it's taken the lives of Nigerians, taking the life of other West African countries. Nigeria could invest in saying that there's good treatment, invest in vaccine development, because this is a disease that is mainly in West Africa. We can do better. And when, like soldiers, when they paid ultimate sacrifice, they lose their lives in the battle, how do we care for their families and their loved ones? The case of Dr. Victor Idowu that I read was working in Kogi State. The Kogi State government provided a house for the mother, and the family were enrolled into the state health insurance scheme. I propose that there should be a special benefit package. When doctors die in the front line, it's like soldiers who die at war in battle. In developed countries like the US and other countries, there are special benefits for soldiers who die in battle. There are benefits. You know, we should extend in Nigeria, the government and private sectors who employ these doctors. There should be package life insurance. There should be package that should be for the family members of those who died. Dr. Mansur Mohammed left behind a young wife, a young wife who was pregnant, and Dr. Mansur Mohammed, who was working at the Federal Medical Center Azwari, he left behind a pregnant wife and a 1-year-old child. At the time this report was released in February 2025, first son was 6 years. The child she was pregnant with was 3 years at the time. What provision is there for Khadijat Ibrahim, the widow? What provision is there for the children who lost their father? According to Khadijat, he was treating Lassa fever patients. Dr. Mansour Mohammed was in the front line battling disease, taking care of Nigerians in Azwari, Bauchi State, contracted Lassa fever and died. What is there for what is provided for his wife and his children? Can the government do something the way Kogi State government did something for Dr. Idowu by providing something for the family? They provided a house and they provided health insurance. Can there be something that can be done so that in the final stages of that horrible disease, when they are still conscious, because it can lead to coma, can lose consciousness. The final stages when these doctors were still conscious and when they know they could lose the battle, they would be comforted if they know that something is in place for their family members. Dr. Abel lost the father at a young age, sponsored to school, the clear breadwinner of his family, dying at the age of 32. What kind of provision the government provide for somebody who chose to stay in a place to bridge the gap that was present in healthcare delivery in Igboho, Oyo State? You know, so doctors, health workers who die in the front line because of managing patients who have diseases like Lassa fever or Ebola or COVID or other diseases, doctors who take enormous risk to take care of these patients and who lose the battle. Even before losing the battle, there should be provision to take care of them while they are still alive. And then there should be provision. Please take care of their loved ones. Any doctor you see in this country is a breadwinner. It's a breadwinner to his own family, to his extended family, and even to some extent to his community. And as such, when that person die at their prime, it's a huge loss to the family, extended family, and to that community. The government or those who employ the services of these health personnel should take cognizance of taking care of their family, those they've left behind, take care of their loved ones, so that in the final stages, the health personnel can be reassured that the government will look after their loved ones. Because at the end of the day, that's going to be the pain of not having enough time, of not having enough opportunity to do well by those who sponsored him or her through school, or those who had so much hope, so much belief that, oh, our daughter, our son as is now a doctor, so we'll be able to take care of us and take care of our responsibilities and all that, you know. So the final stage is, if a health personnel in that circumstance realize that yes, there's something for them for his or her loved ones, at least that will serve as a little comfort for them at the final stages, and will serve as a moral booster, as encouragement to other doctors who are at the front line fighting these dangerous diseases like Lassa fever. So next, I will talk a little more on Lassa fever. I'll narrate the experience of a doctor who survived Lassa fever. I'll talk about what the World Health Organization, the CDC, has written about Lassa fever. Then I'll talk about the origin of the name Lassa fever, and how those who are from the Lassa town in Borno State have challenged why the disease was named after the town, and how that name has stigmatized the town and stigmatized those from the town, and how they fought to see that the name was changed. They did not succeed, but they were able to make their case at the World Health Assembly that the name of the virus should not have been named after the town of Lassa. And in recent years, we see that they've stopped naming diseases. The World Health Organization, World Health Assembly, they stopped naming diseases after the place where the first victim of the disease, the first patient was found. You know, like we saw COVID in China, where before it had been the China virus, or the name of the town in China where the place was found. But we see that the name of the disease was COVID-19, and that the name of the virus was SARS-CoV-2. You know, so all of this I will talk about in subsequent um, sections or parts of this discourse.